Hi, I'm Tim Wiedrich, Section Chief for the Health Resource and Response Section with the North Dakota Department of Health. This is the statewide hospital operations briefing, and let's go ahead and begin by checking in with Tim Blazel with the North Dakota Hospital Association. Tim?
Hi, good afternoon, Tim. Good afternoon, everyone. Just a quick comment I'd like to make, and it's related to some CARES Act dollars that the hospitals are receiving from the state. There's roughly $15 million being awarded to the hospitals here in the state by the end of the month. There's going to be $12 million awarded to the bigger facilities. Those bigger facilities are the ones in Fargo, Grand Forks, Minot, and Bismarck. But there's roughly $3 million being awarded to the critical access hospitals. So the reason I mention this is, and again, that $3 million is going to be distributed by the North Dakota Hospital Association. So how that's going to be distributed and when, that information has gone out to those critical access hospitals. So my message is more for the critical access hospitals on this call. And I'm not sure if we have any of the CEOs on this call. But again, we are working on that. We have sent out to all the CEOs a sort of grant application, and the deadline for submission is tomorrow. And so I've heard back from roughly 25 of the 36 CAWs. So just a reminder to all of those that want to participate in the program that haven't, that deadline ends tomorrow. And we're hoping to have, well, not hoping, we need to have those funds allocated to those critical access hospitals that qualify by December 30th. So just a reminder for those facilities on the call as it relates to CAWs that that information's been sent out and the grant deadline is tomorrow. So Tim, I think that's all I have. And then again, I'll just jump in from time to time.
Let's check in with Cody Pinks and see if Cody has an update regarding the hospital data.
Hi, Tim. Sure. I have a quick update. I'll let Clint get the slides up for me. Oh, you can go to the next slide, Clint. Thank you. So I've received quite a few questions from hospitals about the new reporting requirements that was sent out recently and whether we are still meeting those reporting requirements through our reporting through HE standard. And the answer is yes. The information you're all reporting through HE standard is still meeting these requirements, and we will still continue to report on your behalf. And so, as you can see, we already have the influenza fields are in HE standard, and I believe a lot of people, if not all of them, have already been reporting these numbers to us. But they were technically not mandatory. They start being mandatory fields starting December 18th. And so I actually wanted to just quickly go over the reporting of these questions real quick. Some patients may be counted multiple times on this tab. What that means is if you have a patient that has both COVID and influenza, that patient would be counted in 3 different areas on this tab. So if you're the patient with influenza questions, it would be counted there. Patients with COVID, that person would also be counted there. And then there's a third question here that asks if a patient has COVID and influenza. And so you would include that particular patient 3 times on this tab. So that's all I wanted to share. These are in HE standard, and they do become mandatory reporting questions in 2 days. This following page here, I added the therapeutic course inventory and usage questions that will be added into HE standard. It's not added yet. We have until January 8th to get these into HE standard before they are mandatory. These questions only need to be reported on once a week, which will be on Wednesdays. Even though they're not in there yet, when we do plan to add these into HE standard, I will definitely let everybody know when they get added so that everyone can prepare. And I don't know if we'll have any issues with having to resubmit questions or answers to questions. I know that last time we made an update, some of the tabs got zeroed out or became blank, and people were not aware of that. So if that is something that we're concerned about this time around, I'll let everybody know. The updated FAQ document did have a placeholder for potential therapeutics. I believe it's question 40, page 12 in the document, but do not stress, these questions do not need to be reported on until an approved therapeutic is designated for those particular questions. My last slide is, I just found out recently that HHS and CMS is holding a webinar tomorrow to review the changes to the FAQ document. I included all the information on this slide for those that want to also attend this webinar. I also included the agenda to see if you would be interested or not. I do have one last favor to ask all of you. We are really trying to streamline our hospitalization data throughout the department. And so I've been working with disease control and other people to see what we can do to make things easier for reporting. But if you have patients that are hospitalized due to COVID, so not including those with COVID that are hospitalized for other reasons, if you have any patients that are hospitalized due to their COVID diagnosis, can you please reach out to me, because I actually have a few follow-up questions for you. And that's all I have, Tim.
All right. Thank you for that. Well, we do have Grace's slides, and so let's hand it back to Grace. Go ahead.
Okay, perfect. Clint, if you want to load the slides. Next slide. All right, so continuing our trend from last week, we do continue to see a decrease in the reproduction number for the state. And we estimated this about 4 days ago, and we are currently sitting at about 0.78 for our reproduction number. And what that basically means is the pandemic is not going to more than one person. So each new case is giving it to quote unquote less than one person, which is good news. And if you remember, the first presentation that I did when I joined this group was on what the RT value represents. And the good news too that goes along with the low number is we also have it's not really as low as we would want it to be, but in terms of the active cases in the state, we are also seeing a really low number compared to what we were seeing in the previous couple of weeks. So that's good news. Next slide, Clint. And this is where our counties are sitting. We still have a few outliers that are above that one value. Barnes, I believe, well, actually it's Benson, Billings, Logan County, and Golden Valley. So these are counties that we are seeing an increase in the number of cases, and the RT value is corresponding with that. And the good news is, at least it's in our smaller counties. Like I said, you want a low RT, but you also want a low number of cases. And so for these counties, the good news is that they are smaller counties in terms of the absolute number of people who live there. And even though the RT may be high, it's not, the spread is not as widespread as, say, if we were seeing this value in a place like Cass or Burleigh County. Next slide, Clint. And this is just a change from the previous week in terms of the RT value. We do see a few counties such as Towner and Billings, Benson and Wells that have seen increases in their RT value. But overall, we're seeing either a decline or really a stabilization of the rates throughout the state, which is, again, really promising. Next slide, Clint. And I just included these next couple of slides for the reproduction values for the large counties. One of the questions that we've been getting from the media and from the public and a few parties is basically like, what is driving this decline in the state, and is this all tied to mask mandates? And the one thing that I like to highlight is a few of the largest cities which were contributing the largest absolute number of cases in the state, such as Cass County and Burleigh County, as well as I believe Ward, and the next one is Grand Forks. These were the counties that had the largest number of cases in the state and were also contributing to most of the spread that was really putting us at the top of these rankings of North Dakota being the worst state for new cases. And these are the counties that also had mandates, local mandates before statewide mandate. And so we almost had this sort of like lead in terms of like helping try to mitigate this at the local level before the statewide effort then really took hold. And so I believe that has really contributed significantly to the declines that we're seeing throughout the state. Next slide, Clint. And then in terms of the just the top 6 counties for other issues, current hospitalizations for actives, the good news is, again, you're seeing a lot of the hospitalization is in the smaller counties. So Kidder, Emmons, Bowman, Divide, Oliva, and Golden Valley. They do have the highest proportion of active cases that are hospitalized. But when you look at the, again, absolute numbers, which is where as a hospital you're probably more concerned, which is on the right end, and that's the long-term care case count, because these are the individuals who are likely to have severe morbidity and also be hospitalized. You do see, again, the sort of like the same 6 counties that sort of like interchange with each other, because that's where the largest population of the state lives. Next slide. We have touched on this a little bit in the past, and this is just the community spread. And again, this is one of those indicators that kind of tells you, like, how much of the disease that you're seeing in your community or at the county level is actually cannot be traced to a source. And when you go to the next slide, so the distribution looks fairly, it's, I wouldn't say random, but it does look pretty high in some areas. The good news is while the proportion may be scary in terms of absolute numbers, I believe this is the lowest that we've seen in terms of the number of individuals who are saying they have no idea where they acquired the infection, which I believe is actually good news for us, because it does point to, one, the decline that I was referring to, but then also two, the ability to trace where you acquired COVID is really a good mitigation strategy, and that's where contact tracing usually comes in. Next slide, Clint. COVID hospitalizations by month. Again, we continue to see, this is just an updated slide of what I've shared in the past. So we do continue to see basically what is the percent of cases that are being hospitalized continues to decrease, and that's the column of, I think it's the 5th column, or at least in the middle. So in March, that was at 20%. And in December, up till yesterday, we're looking at about 2.4% of our cases being hospitalized. The average length of stay continues to decline. And then also, we are seeing fewer individuals who are being hospitalized longer compared to what we were seeing previously. And I know some of this is tied to, some of the outpatient treatment, and obviously like the decline in the number of cases, and also decline in the number of cases in the most vulnerable populations, which includes our long-term care facilities. Next slide, Clint. And then this is just an updated slide. And this came about in the discussion around vaccines. And it's probably not telling you all anything new, but what really this highlights is, again, that age-related risk of mortality. But again, mortality is tied to hospitalization, and hospitalization is tied to comorbidities. And so in the discussions that we were having earlier today, we really were sort of like thinking, what would be a good prioritization in terms of really making sure the most vulnerable are getting the vaccines after the first few tiers have been not really certified, cemented. And this is a good chart to just refer to, kind of like keep it all in perspective in terms of who is at the highest risk of mortality and morbidity. Next slide, Clint. The other good news is what we're seeing in the region as well is declines. And so across all, I think the 4 states that are neighboring North Dakota, so Montana, Minnesota, and South Dakota, we are seeing declines in the number of cases. So this trend seems to be, it seems to be following a similar pattern. And if you go to the next slide, Clint, I think that's the hospitalizations. The hospitalizations are also following a similar trend, which was quite surprising to me, especially South Dakota, because the mitigation strategies there have been not as strong as what we have in North Dakota. But overall, I think this is good news for the region as well as North Dakota. Next slide. And this is just a continuation of the same, but actually this is where I think the point about South Dakota is actually more prominent, which is this is actually the number of cases hospitalized per 100,000 people. So you do see that South Dakota is sort of like that. It is on the decline, but it's also on the higher end compared to the other 3 neighboring states. Next slide. And these are just some notes that were shared by the North Dakota Medical Association Physician Advisory Group in their meeting last week. And we keep, I don't know if any of you had the time to listen into the press conference, but there's just, lots of promising work happening in not just, the vaccine, but also in therapeutics, and in also trying to keep people out of the hospitals. And so the Physicians Advisory Group has really been, excellent in leading this effort of making sure that, treatments such as, the monoclonal antibodies are available before you need the hospitalization. And so that's something that I see gaining momentum throughout the state moving forward. And then, of course, the vaccines being in North Dakota is quite promising. And so this slide just shows our 90-day COVID environment. The blue is our projected number of cases. The orange is the actual daily cases. And, this is great because our model was projecting much higher cases than what we're seeing in actuality. And really moving forward, what we expect, at least for the next couple of weeks, if we continue with our current trajectory, would be a decline in the number of cases through March. Next slide. And based on the number of cases, the hospitalizations will also continue to decline. And this also, again, the model is projecting much higher cases than what we've currently been experiencing. Next slide, Clint. So the one thing I would like to highlight, and this is based on the previous slides around the 90-day COVID environment, what we're seeing across other states that have mask mandates is that there is this window of when you actually do see declines in the number of cases, hospitalizations, and deaths. And it seems to range from about 90 days to about 116 days. And I think Arizona and Kansas are the two ends of this range. And so from the beginning of the mask mandate, you observe this decline, and then about 90 days after, you start seeing an increase in cases. Of course, these data were published before we had a vaccine, and depending on how fast that's rolled out throughout the state and, reaches the most vulnerable, it could be that we don't get to see that uptick. But I just wanted to highlight that there is that potential of, in January, as, after the holidays, and then, with kids going back to school, universities opening, there is that potential of seeing an uptick in the number of cases that you see in the state. But for now, I believe that, between our mitigation strategies and potentially the vaccine being rolled out, we might be in better shape than these other states when they did their mandates. Next slide. And then the other thing is we do continue to do our wastewater surveillance, which is looking through the wastewater to detect the RNA particles of COVID in the water. And overall, we are seeing an increase in some parts of the state. And while this is new science, new research, and we really don't understand the full correlation of what's happening in the wastewater versus what's actually detectable in clinical cases, it is something that we're keeping in mind as we sort of look forward in terms of mitigation, and then also what the COVID environment may look like in North Dakota. So we may not be out of the woods yet because we do continue to see high levels of COVID RNA particles in our wastewater, and this over time seems to be increasing. So I will end there, Tim, but I'll stick around for any questions, and thank you as always for having me.
All right, thank you so much for that information. Let me do a quick update on some of the information that we have regarding the staffing levels within the hospitals, and then also with the staffing that we have for outside entities that have provided staffing from the Department of Defense and Eminent. So, Clint, if you could go ahead and bring my slides up. I'm grinning because we have a soft phone now that's on my computer, and apparently my phone has followed me into the studio now. So in terms of, as you know very well, each day the hospitals are reporting at about 12 o'clock or so, and we publish a snapshot in time for hospital bed availability. And these numbers have improved substantially over the last several days. So as of yesterday, obviously I took this before today's report was out, but we had 27 ICU beds available within the state, and we had 326 in addition to that of the general beds that were available. So substantially better picture than what we've had in the past. And then as we look at the PPS hospital totals, you can see that of those 27, 21 are in the six PPS hospitals in the 4 largest cities, and an additional 105 general beds in those PPS hospitals, meaning that the subtotals then for those beds would be 221 for the critical access hospitals for general beds and 6 for the ICU beds, bringing us to where the statewide totals are at. So a substantially improved picture from where we were previously at. In terms of where the nursing staff are coming from for this gap or surge staffing, for the Department of Defense, we have 60 nurses that are in state, and as I've previously said, December 23rd is the end date for that mission. We have requested that they be extended for another 2 weeks, taking it to January 6th, and our request did indicate that there is a review that will happen during that time frame. So even if the extension is granted, it's possible that those nursing staff will be redeployed outside of North Dakota during that 2-week time period. There is a substantial increase within the rest of the nation regarding the demands for nurses. I know that I heard on the media reports this morning that California is requesting 200 DoD nurses, for example, and that's true across much of the rest of the country as their hospitalization numbers have risen and their available beds has decreased. I'll come back to a little bit more detail about the DoD nurses in just a moment. We have 94 eminent nurses that are currently in the state, and then 75 full-time nurses that are temporary employees within the health department that are providing COVID response. So to drill that down in even more detail, with the Department of Defense, the way those that are currently deployed is that we have 20 of the 60 that are assigned to ICUs in the major or the PPS hospitals in the major 4 cities, and then there are 40 that are located in the PPS hospitals as med-surg. And as you review the chart that I'm displaying, you can see what that distribution is. So that's how the assignments for the DoD is being deployed. Regarding the eminent nurses, there's a total of 38 ICU within the state. 28 of those are within the PPS hospitals, and those distributions can be seen on the chart. And there are 19 eminent nurses that are in a med-surg capacity within the PPS hospitals, and again the chart is displaying what that distribution is. So we have a total of 47 eminent nurses that are in the PPS hospitals. Then, in addition to that, for critical access hospitals, there are 4 that have deployment of eminent nurses. 10 of those are with ICU beds, and then 12 are with med-surg for a total of 22 currently assigned to critical access hospitals. And then finally, we have 25 nurses that are eminent nurses in long-term care. So the total for PPS eminent nurses for the PPS nurses would be 47. The total for the critical access would be 22, and the total for long-term care would be 25, bringing it to a grand total of 94. Just for a little bit more visibility, coming back to the health department temporary employees, we have 75 of the temporary 75 of the temporary full-time nurses that are employed by the health department as part of the response. And then there's 114 part-time nurses, bringing that total to 189. In addition to nursing staff, we have a wide variety of other staff. You can see that there are 27 nurse aides that are employed by the department on either a full-time or part-time basis. We have 43 of the emergency CNAs that are employed, and we have 94 EMS providers. There are 62 couriers, and then finally there are other categories that are from a variety of disciplines, bringing that total to 44. So in total, there's 194 full-time employees temporarily employed by the health department, 265 part-time employees for a total of 459. So that's the way the numbers are stacking up, and we expect to hear relatively soon on the decision regarding the Department of Defense nurses, whether they'll be staying beyond December 23rd or not. It's my hope that we'll be hearing yet on that this week. But again, nobody's told me that we'll hear it by the end of the week, so we'll stay tuned and see exactly how that plays out. Also, in terms of the eminent nurses, we've gotten some feedback that if eminent nurses are continuing to be desired, if needed, that we're going to need to notify eminent of that need in the next several days or so, and there'll be some more information coming about regarding that in the very short term as we look at what our way forward is for the nurse staffing. So that was the update that I had for you relative to the nurses, and so let me now turn to George Gerhardt. George has some information about this important topic, and that's the vaccine distribution that's currently underway. And let me turn it over to George.
Hi, good afternoon, everybody. As you all probably know by now, is that North Dakota has received their first allocation of vaccines. Some of it was direct ship right to the facilities. Some of it came here to our warehouse, and we do have a short clip of the redistribution process at the warehouse. Here you can see our room where we do our redistribution at. These are the ultra cold upright freezers that we have. Once they come in, with the box is received, there you can see our warehouse manager, Stefan, bringing the box into the warehouse. Each one of these containers can contain up to 5 trays of 195 vials each. Opening it up, and it also is packed with dry ice. So once we get it, we go ahead and open it up, turn off the data logger and GPS locator. You have to go ahead and hold the button for like 5 seconds, and it automatically turns off. This reports its location and the temperature during the transmission back to our warehouse, and we can monitor that, and Pfizer can also monitor that. We go ahead and remove the dry ice, brush it off the top of the container, and then using the chirogenic gloves to make sure we don't get our frostbite or our hands burned. And then I'm taking some of the dry ice that's in there and making sure it's out of the way. And then lifting up the deal. And Stefan is going to go ahead and lift the package out. And from there you can see the individual trays packed inside. And then we'll remove the trays and put them into the ultra cold upright freezers. Pfizer came out with some pretty strict guidelines on how we handle the ultra cold and how we go after it. Each one of those trays can only remain outside of the ultra cold environment for a few minutes at a time before they have to go back in and spend 2 hours back in the ultra cold to make sure that they maintain temperature. So once these were back in for 2 hours and we maintained temperature, we went ahead and did the distribution. He opened up the package, the tray, and here you can see the 195 vials. As soon as I can get it open. So 195 vials packaged in each tray. We do wear gloves to help keep it from burning our skin. We have to count out each vial and for that order, and then it's confirmed. Once we take it out, it's placed inside either the styrofoam holders or or a bag, and then it's placed in a refrigeration unit that we monitor at all times. We monitor the temperature in there. They do be, when we do transport them, after we've taken them out of the refrigerator or the ultra cold freezer and handled them, the thawing process starts as soon as we handle them. So at that time, we can transport them in just regular refrigerators, and then the thawing process starts and the 5-day clock starts ticking. Once that happens, we there, and as I said, the data loggers that are on there, we monitor here at our office to make sure that the temperature is maintained, and we also track the vehicles as they're transporting to their locations. So this week we've made approximately 6 deliveries, and so far they've all went very smooth. And that's all I have for you at this time.
Great. Thank you, George. Appreciate that information. It was good to see the video and see how that's being done, and the fact that we do have oversight by a pharmacist during this entire process as well. Let's go ahead and check in with Angie, who has information about the status of the warehouse and the PPE. Angie Strand?
Thanks, Tim. How's my audio?
Can hear you just fine.
Perfect. Okay, so we'll go ahead and start with just a snapshot here of what's in the state medical cash. We do continue to try to get through state contracted and other vendors throughout the nation additional PPE. So we're continuing to push that, but we are slowly but surely receiving PPE into the cash delivered, and hopefully we'll have the open purchase orders that we have out fulfilled by the 30th of December. So we'll go ahead and start with the N95s. Currently, we're at 1,066,000, with 451,000 of those being the 3M 1860 and 1860S models of the N95s, what the majority of health, medical, and first responders in the state are fitted to. The rest of the numbers account for the 3M 1870 and 1870 plus models that we've received. They will require fit testing if you haven't done so already, since fit testing is brand and model specific. Also, we continue to push for additional 1870s in the cash because they are within the 3M healthcare category. And as always, we encourage practicing conservation measures as well as getting your stuff into the Battelle system. If you need assistance with that, I'll be happy to walk you or help you through that system to get that utilized. Additionally, for surgical masks, we're at 2.8 million with 7,400 issued from the cash within the last week. Shoe coverings are at 20,786. There were no requests for the shoe coverings within the last week. Gowns, there was a little bit of a jump in numbers compared to last week. We're sitting at 632,164. We are continuing to get deliveries of the gowns in. We do have a few open POs or purchase orders open for those. We issued about 3,500 within the last week when it comes to gowns, so individual gowns. Gloves are at 1.3 million. 163,700 pairs were sent out within this last week. Also with these, we do have open purchase requests that are needing to be filled. These are one of the bigger requested items for HON asset requests that are coming in. For face shields, we're at 636,712. There were 1,300 issued within this last week. And for goggles, we're at 17,457, and there were no requests for goggles within this last week. And that's all I have, Tim.
Thank you, Angie. And let me just restate the importance of getting fit tested now to the 1870s. Again, it's 3M's projections that we won't receive any substantial quantities of the 1860s until probably next October. And so this time should be utilized now to be fit testing against the 1870s and the 1870 pluses so that you're ready for the transition, because we're not far away from not having 1860s and 1860Ss available any longer in the state medical cache. And there doesn't appear to be any short-term solution to acquiring them in any significant quantities from 3M. So just strongly encourage you to use this time now to begin those fit testing processes and get your staff fit tested for the 1870s and 1870 pluses. Thank you for that, Angie. Let's turn now to the VP3 team and check in with Roseanne, Jan, or Seth.
Okay, this is Roseanne, and just want to provide a brief update just to let you know that exactly what Grace is talking about is what we're seeing happen in both long-term care and the hospitals. So I keep going back to November 13th, Friday the 13th, as our highest reported number of active cases in long-term care, and that would be staff and resident positive cases. And at that time, it was over 1,500. Today, it is reported out at a little bit less than 300. So a pretty significant change in about a 5-week period of time. So we're really happy to see that. And also, the hospitals are seeing a decrease as well. We do a daily huddle with the 6 big hospitals every single day, and we're finding that it has changed significantly there too in the last month, because we've been doing this for about a month. So ICU numbers, and the number pretty much steady in the ICU numbers, but the number of ventilated patients has decreased, and the number of overall med-surg COVID numbers have decreased. So that's kind of what we're seeing. We're happy to see it, and we're thankful we haven't seen any increase in, surging of, from the Thanksgiving weekend. As Grace predicted, it would happen probably early this week, if it was going to happen. So we're happy with that, and it's going the right direction. And I think that is all I have to report.
Thanks so much. That is the information that we had for you today. Let's check in now with the hospitals and do hospital rounds. We won't go city by city. We'll just basically ask you if you have a question or a comment. Just go ahead and open your mic and state your question or comment. All right, not hearing any. That will close out the information we had for today. We'll be back together again on Friday at 2 p.m. Take care, everyone.